When we talk about fat and we talk about inflammation, can we talk about the difference between those two and how they show
Yeah.
up in the body?
We have subcutaneous fat that is basically what's under our skin. So if somebody has liposuction, what they're going to remove is subcutaneous fat, right? That is not a bad fat. That is not a pro-inflammatory type of fat. Then we have intra-abdominal fat, which is inside our abdomen that attaches to your internal organs, to your liver, to your gut, to your pancreas. That's what we call the bad fat.
And what was that one called again? That's
Visceral fat.
the visceral fat.
Visceral fat.
Right. Okay.
So this can cause, and visceral fat is a pro-inflammatory tissue. So in that fat tissue, in the adipose tissue, there's cytokines, which are inflammatory cells, right? So they promote inflammation in your body. This is the fat that can promote different types of cancer because of the constant state of inflammation that the visceral fat is on. Now, if it surrounds your organs, it can lead to, in your liver, fatty liver, right? In your gut, in your pancreas, can cause insulin resistance. So that's the fat that we want to target whenever we're talking about weight loss.
Right.
We're really targeting visceral fat. That's why somebody, let's say, with that overweight and they have high subcutaneous and high visceral fat, if they go with plastic surgery and they have liposuction, it's not going to touch the visceral fat.
Got it.
So they're still at risk of disease.
So they'll have the vanity part might be
Exactly, the
somewhat
cosmetic
gone.
external part, but the metabolic part is not touched.